Writing your views for an Education, Health and Care Plan, EHCP Needs Assessment. For some children and young people with special educational needs, the support they receive at nursery, school or college may not be enough and your child or young person may not make expected progress. It may then be necessary to request a needs assessment, which may lead to an Education, Health and Care Plan. The views of parents, carers, children and young people are very important and will be included in the final EHCP. It is useful to focus on areas that educational settings or other professionals writing reports may not be aware of. You can start by making a bullet point list of things as you think of them. This will give you a start for when you complete your views, wishes and aspirations. Remember that as parent carers, you can get used to your child or young person's traits or quirks and make adjustments within your home and family. Please remember to include these in your views. The booklet is to be used as a guide. Each child or young person will be different. It should be read in conjunction with our booklet, Needs Assessment for Education, Health and Care Plan. If you are requesting the needs assessment to consider if an EHCP is necessary, it is useful to include details about your child or young person, such as their date of birth, early years setting, school, college he/she attends, names of any professionals who have already been involved with your child or young person, copies of any relevant reports, an example of your child or young person's work, your child or young person's views, copies of any exclusion letters. Why do you think your child or young person needs to be assessed? What is happening at school now? What support is in place at school? You'll always be asked your views when an EHCP has been requested. You will be asked to fill in a form from the local authority. Here are some things you may wish to tell them. Not all of them will be relevant to your child or young person. History. What do you remember about their early or school years that might be useful? Were you happy about progress at the time? When did you first feel things were not right? What happened? What advice or help did you receive? What has happened since then? Education. Progress or lack of progress made over the year. What has pleased you educationally and also any concerns? Has the school had any professionals in to assess your child or young person, for example, an educational psychologist? Relationships at school with other children and young people, teachers, tutors and teaching assistants. Progress with reading, writing, numbers, other subjects and activities at school. How the nursery, school, college has helped your child or young person. Have you been asked to help with their education, such as hearing them read or do a project? If your child or young person does not get the appropriate support, what are the consequences? What does your child or young person find easy or difficult? Health, including emotional, social and mental health. Any diagnoses your child or young person has. Independence, what can they do for themselves? For example, dressing, crossing the road, homework. Do they have a sense of danger? Eating and sleeping habits. General fitness and absences from school. Serious illnesses, accidents or periods in hospital. If your child or young person has a disability, mental health difficulties or medical condition, how do these affect him or her at home or at school? Any medicine or special diet. General alertness, tiredness, signs and effects of any medication used. Does your child or young person's health impact on their education? If so, how? Does your child or young person have any sensory needs? Relationships at home with parents, brothers and sisters, friends and other relations, both inside and outside of the home. Does your child or young person make friends easily? Moods, good and bad, sulking, temper tantrums, affectionate. Behaviour at home. Does your child or young person cooperate, share, listen to and carry out requests, help in the house, offer help, fit in with family routine and rules? Relationships and behaviour at school. Does your child or young person have any support at school with their behaviour? Are there things that have worked well at home or at school? Has the school asked your child or young person to go home early? Has your child or young person been on a reduced timetable? Has your child or young person been excluded? Social care. This is wider than education support from social services. It may include other areas such as short breaks, assistance at home or travelling. Has social care been involved with your child or young person? What additional support has been put in place? Has there been support for the family which has helped your child or young person in education? Do you have a social care budget? If so, what does it provide? What additional services do you feel could help? Have you worked with the early support or the family support process? If so, has this helped and how? Your general views. What do you think your child or young person needs support with at nursery, school or college? How do you think this can best be given? How do you compare your child or young person with others of the same age? What is your child or young person good at, or what does he or she enjoy doing? What do they worry about? Is he or she aware of their difficulties? What are your concerns and worries? Are there any other professionals who you feel need to assess your child or young person and why? What does your child or young person want to do in their future? Their aspirations. These are just some ideas. Please write what is appropriate in your particular circumstances. All EHCP forms need to be returned to Norfolk County Council, SEN Operational Support Team, Professional Development Centre 144 Woodside Road, Norwich NR7 9QL. How can we help? We can give information, advice and support on EHCP applications, refusals to assess, needs assessments, writing your views and wishes, refusals to issue, personal budgets, draft EHCPs, funding, annual reviews of EHCPs, mediation and disagreement resolution, appealing a final EHCP, send tribunal, complaints and local government ombudsman. Visit our website for more legislation and to read Chapter 9 of the SEND Code of Practice. We have a variety of information booklets available on the website covering the EHCP process. Contact us, Norfolk SEND Partnership, 01603 704070, 0786 0033614, sendpartnership.iass@norfolk.gov.uk, www.norfolksendpartnership.iass.org.